So I'm scrolling on the internet and I come across an article as I'm scrolling, and the article just stands out to me. And it says that nurses unable to pay rent and relying on food banks. Let's talk about it.
You can live pretty well by yourself.
What's good, everybody? It's your man CJ Kyles, aka the High Value Nurse, checking in once again, back with another video. Get paid, young nurse, get paid. Now, yeah, ladies and gentlemen, I couldn't believe it myself. Now, this article comes from the publication, the Daily Mail. Y'all know how I get at night. It comes from the publication, the Daily Mail. I'm assuming this takes place in the UK because I believe they're a UK website. If I'm wrong, please correct me in the comments, as I know you will. But I came across the article and I said I'm gonna read some of it to you because at this point, I think it's foolish now. And it may be even foolish to even get into this field if it's getting to the point to where you as a healthcare provider have to rely on food banks and you're unable to pay rent to survive. Now, I know that this is going over in the UK according to this article, but you do have wage issues that nurses are fighting for here in the United States. And again, we can send $40 million over to the UK, or 40 billion, or however much they're sending over to the UK, but you won't take care of home first. Now, my heart goes out to all those people that are affected over there in the UK and that are affected by that. But again, you have to take care of your defenders first, your healthcare workers, your police, your firefighters, all the people that are set up to defend you. That is who you need to make your first priority. But I want to talk about the article right now. So I'm going to read some of it to you, and we're going to go from there. So let's do it. It says nurses are unable to pay rent and are relying on food banks, MPs have heard. The Royal College of Nursing said the workforce is in a critical situation. The warning comes as reports suggest that 6 NHS trusts have set up food banks. I'm guessing that's their emergency services over there in the UK. And they're saying that they've set up food banks for staff to help with the rising cost of living. Now, things are also going up here in the US. Gas is almost $7 in Michigan. Well, not $7 in Michigan, it's almost $6 in Michigan. I know it's $7 in California. So, yeah, it is real. It's definitely real. So let's get back to it. Dr. Denise Schaefer, the president of the college, said that pay is also linked to safe care for patients. Well, you don't say. Because nobody's going to do this for free. Nobody's going to do this for pennies either. You don't say. Pay is also linked to the safety of the patient. So you know why? Because if you don't pay me, I won't be there. And that's what they're experiencing right now. Now, unfortunately, maybe some of these people over there don't have savings and whatever the case may be, so they are relying on these resources from their own government. It says we have nurses that are unable to pay rent, afford their patrol to get to work. I'm guessing their car. That's what they mean. Their car. Maybe that's how they refer to their transportation, patrol, to get to work, and they're unable to get a mortgage. Dr. Denise Schaefer also said that staff retention was a critical issue in the sector, and it was having a major impact on safe staffing levels of nurses. You don't say. It says at a meeting of the Health and Social Care Committee, Dr. Schaefer said the situation for nursing is really quite critical at the moment. Same with over here. It says we've got a huge problem. Well, hold on. Let me see. It says we got a huge problem with retention. The Nursing Midwifery Council published figures last week around the increase in nurses that are leaving the profession. She added that nurses are not able to give safe care, and that's very bad for patients. It's also bad for business too. Let's not ignore that elephant in the room. It's a bad business move too. Like, let's just keep it a stack. Our concerns are particularly for the harm that could cause the patients by not having enough nurses. We don't want to see any of the scandals we've seen in the past. Was that a shot? I think it might have been a slight shot. Well, she was asked what could be done about it. She added, we can't get away from the fact that pay is an issue. We have nurses that are unable to pay their rent, afford their car. They're unable to get a mortgage for work. We've spoken to a number of members that just cannot get a mortgage. They are relying on the food banks. Clearly, pay is obviously critical, and we can't move away from that. All y'all that, it shouldn't be all about the money and everything like that, I don't want to hear that shit. Stop the cap. These people can't even pay their rent, can't even get a mortgage, can't even keep up their car to go to work, relying on food banks, and these people are in here saving lives. That's crazy. It's absolutely crazy. I tell you what, the day that they tell me that I need to go to a food bank in order to survive, or the day I feel I need to go to a food bank to survive, I will go take a job at Target, $24 an hour. Stop playing with me, man. Or I will go out here and DoorDash, do something. But I will not be in the field that refuses to pay me adequately for the service that I do. That's slow. That makes absolutely no sense on any level. Let me see. She said that nursing pay has been behind the curve for some time. We cannot afford not to address this. I don't know what they get paid over there in the UK. But I don't think it's anywhere close to what nurses in America get paid. So, I think as nurses over here, we're pretty fortunate. But again, things can always be better, because I feel like nurses over here are not getting paid what they're supposed to be paid. Point blank, period. Let me see. I've got many friends and family members that are nurses, but they actually just can't do it anymore. And that's what we're seeing. People are walking away. We have got to tackle that fact. We are losing nurses. We can't afford to lose one single nurse. Not one. And it's so funny. And just to go away from here for a second. You have so many facilities, right? There's so many that treat their staff still like garbage. Talk to them any kind of way. Management will talk to them any kind of way. As if you can afford to do that, as if you have leverage. Now, I get it. This is a business, and it's gonna run. This wheel is gonna roll whether you're there or not. But at some point, it's gonna come down to the point to where care has to be taken into consideration, because anybody with common sense is not gonna keep putting their family members in a place that has no care, proper care anyway. At least I know I wouldn't. I would take care of my family member myself before I constantly send them off to a place that I know lacks good care. I think that's just having good human decency at the most part. Let's see, it says Gil Walton, chief executive of the Royal College of Midwives, told the committee that the midwifery workforce is also very fragile. Nobody there to deliver them babies naturally. That's a shortage. You ain't paying them, and I don't know what y'all gonna be doing about them babies, because it's a lot of y'all busting it open. There's still a huge shortage, and in fact, there are less midwives in practice than last year, she said. She added that we are very far off from being able to provide quality care for patients. The Royal College of Midwives believes that The gold standard is what every woman needs until there is enough midwives in the system. It is not ready to implement the way that it should be. Wow. I mean, that's pretty much it. That's the article. But lack of pay, lack of care, lack of business. And eventually they'll get it. They'll get it. I mean, they really don't have a choice unless they want their business to just straight up crumble. And you don't want to make the people desperate, because when people are desperate, they'll start doing things that you wouldn't think they would do, and not necessarily negative, by the way, either. Man, you get some of these people, they can't go to the hospital, get proper care. These people start coming up with their own remedies and all that kind of stuff. And but let me slow down. I ain't trying to come up missing and nothing like that. So, but yeah, man. That's real talk. Like, there's no reason why any nurse should be going to a food bank. There's no reason why any nurse should not be able to pay their rent. There's no reason why any nurse should not be able to pay for a car or anything, unless you're just bad with finances. That's one thing. But this is totally about the lack of pay that these companies are giving out. So I don't know, man. I think it's getting crazy out here. It's getting spooky. Let me know what y'all think, man. Because like I said, man, if this continues, I don't think it's not looking good. It's not looking good. But I think eventually something has to give, but who knows? Who knows? I'm just a nurse. That's it. I just want to get in and out. Just give me my money, give me what I'm worth, so I can go on my vacation and call it a day. I don't ask for much. So anyway, that's been today's video. Let me know how y'all feel about that. Please leave a like, comment, subscribe. We are almost at 1,500 subscribers, with the next goal of being 2,000. I want to get to 2,000 subscribers by, let me see, what is this, May 25th, June, July. I want to get to 2,000 subscribers by August. So that's my goal by August. Help me get to 2,000, but I can't do that if you don't hit that like button, if you don't share, if you don't comment, if you don't subscribe. So I appreciate that. I'm working on some things too, some side things that's way different than nursing, but it's some business ventures that I'm gonna be bringing to y'all pretty soon. So in the meantime, y'all take care of yourself, watch yourself, keep your head on the swivel. My heart goes out to all those families that was affected by that massacre that took place earlier in Texas. I say a prayer for the families and the victims, and stay prayed up, man. Real talk. So until next time, if you don't do nothing else, get paid. Young nurse, get paid. Peace.